I'm on the line with us, Kathryn Lewandowsky. Kathryn is the Whole Washington Board Vice Chair and the One Payer States Treasurer. WholeWashington.org, OnePayerStates.org, the two websites. Also, those are the Twitter handles. And then there's Kathryn, R-Y-N, Lewand, L-E-W-A-N-D-O, number 1. Kathryn, welcome to the program. Tell us about achieving a universal health care program state by state, the work that you guys are doing.
Sure. And I want to say thank you very much for having me on. I really appreciate it. Whole Washington really appreciates it. I am a registered nurse here in Washington, and I work with a group called Whole Washington. And so we are working on trying to get a state-level nonprofit healthcare plan passed here in Washington. And we get really frustrated with our elected officials, especially our federal elected officials, that say we can't do this at the state level without getting federal permission first. And honestly, we just can't really wait for the federal government to be doing this because our federal government's not very functional, especially currently. And so allowing this unchecked for-profit healthcare system to continue is just not acceptable to anybody in Whole Washington and the people that I work with, and especially in one-payer states. They've also been doing this work trying to help states do this state by state. Yeah. So basically, we're left with going around them in order to develop a more just and cost-effective healthcare system. And we agree that it's not the best way to have to do it, and it could be done better federally, but it's the hand we've been dealt. And for us, propping up our current system with further subsidies to for-profit entities whom we have no obligation to support or do nothing at all is just unacceptable. So probably the biggest argument about a single payer plan at the state level is that we can't get around the ERISA laws. And where it's true that we can't require a company to give up their current health care or retirement benefits, we can make it optional and we can offer a better plan for them. So that's how we address this, by allowing them to keep their plan. But we're going to make our plan the most cost-effective plan out there. So we can't force them. I'm sorry, go ahead. You have a question?
Well, a friend of mine was the HHS secretary for the state of Vermont when they passed a single-payer health care plan there. And the problem that they ran into, if I'm recalling and understanding correctly, was that because of the constraints built into the original Medicare and Medicaid legislation back in 1965, that money can only flow. You know, there have to be individuals connected to it. It didn't contemplate, Medicaid has, I guess, been more block granted, but Medicare in particular, that money was not contemplated to go to the states for redistribution. It was to go directly to the individuals. And therefore, all of the people on Medicare in Vermont would not have, all that money would have ceased coming into the state. And yet the people on Medicare would still require services, and it would have just bankrupted the state. And so the solution to that was getting a waiver of some sort from the federal government. Am I making sense at all here, Kathryn?
Mm-hmm. Right.
So how do you get around this?
Well, it's time intensive, but it's doable. So initially our plan, one, it's a true public option. And so people can enroll in it. Anybody can enroll in it. They don't have to qualify by being at a certain income level. Anybody can enroll in it, and then once 51% of the state is in, then it becomes a mandatory, still with a transition plan. But for Medicare in particular, it initially starts out as a secondary plan, as a supplemental plan,
as a Medigap plan, essentially.
Yes, as a Medigap plan. Once it's actually voted in, or once it's actually instituted, then the trust board would then apply to become, where right now people could opt in to it, right, as a supplemental. And then we would apply to be a Medicare Advantage plan. Once we became a Medicare Advantage plan, then we would not have to be just paying secondarily.
Oh, that's interesting.
We would receive that black money, and then it would become part of the pool, and it would be managed by the state. And at the same time, basically, we would also be applying for one of those 1332 waivers to enroll all of our Medicare recipients, and then all of the money would flow into it. But you know, if we never got that, we would just stay a Medicare Advantage plan.
Sure.
And if we weren't able to qualify for that, we would just stay as a supplemental plan, the most cost-effective supplemental plan out there because it's for profit.
That's great. So what's the status of this with regard to the Washington State Legislature?
Or I should say it's not for profit, sorry.
Yeah.
Well, it's been blocked. We've had it in the legislature 3 times now, 3 separate bills, so 6 years, well, going on the 6 years. And it still is being refused to get a hearing at the healthcare.
Is that because of Republican obstruction or because of sellout Democrats?
We have a Democratic trifecta in our state.
Right. That's what I thought.
Yes.
So you've got some sellout Democrats is the problem. They're taking money from the health insurance industry.
Yes, and they don't like us making that known.
Yeah. Well, we saw that here in Oregon with Kurt Schrader, you know, and when it got publicized, he was taking all this money from the health insurance industry and the big pharma. Big pharma in particular was his thing, because he voted against the $35 insulin, and the voters just bounced him out of office. Yeah, it didn't work out super well because he got replaced by a Republican, who's taking the same positions, but.
But that's one of the things that kind of frustrates me about some of our politicians, because I think they feel that they need to take this money from the for-profit entities that control our healthcare system. And yet, looking at Pramila Jayapal, she, has done so much for moving along Medicare for All nationally, and she hasn't endorsed us, which we really wish that she would, But let me tell you, she wins by huge margins.
Yeah.
So I just want to tell those politicians out there that if you start siding with the people, especially in regards to healthcare, you don't need to take that money.
Yeah.
That dirt money.
It's absolutely true. If you're willing to have the courage of your convictions and speak up, people will support you. You just have to. The challenge is breaking through and letting people know and getting a mailing list that you can use to raise money. But I think Bernie Sanders really proved that, a decade ago, and now increasingly, and back then the whole Progressive Caucus was only a dozen or so people. Now it's over 100. I mean, it's growing. So that's great. So what can people? We're talking with Kathryn Lewandowsky. She's a registered nurse and the board vice chair of Whole Washington and the treasurer of One Payer States, wholewashington.org, onepayerstates.org, and working on bringing single payer to the state of Washington. And it would be so cool if you guys could just kind of lead the pack and set an example for the nation, like the Pacific Northwest has done with vote by mail, for decades now. So what can people who are in Washington do to help and support you? And what can people who are, most of our audience is not in Washington state, what can they do to help and support what you're doing or replicate it in their own states?
Oh, definitely trying to replicate it in your own states, I think, is awesome. Also, we are all volunteer. We're currently hoping to hire an executive director, and all that's being worked on right now. But we need money, and we just need people to give us $5 and share it with 5 of your friends. We need to be able to get out into the network more,
right?
Not just the people. The thing is, I think most people go through life, especially in their middle years, they feel that they're invincible and they don't feel like they need health insurance. And it's very few people that do need that. And yet they take up a huge amount of what we spend,
right.
And we don't need to spend that much. If we could spend a whole lot less by taking care of our people.
Right. So I've got 2 URLs here, 2 websites that I've mentioned several times. Is one in particular where you would like to focus? It seems like just pushing out one would be more effective.
Oh, I would say wholewashington.org.
Okay, Whole Washington, WHOLE, Washington.org. And
because I really feel we are almost there. Although I would like to say too that I really feel like this is probably going to be passed by a ballot initiative. But I really wish that it could get a hearing because, we had a lot of healthcare people work on this bill. But what I see in the legislature is there's a lot of going back and forth and making amendments and making improvements. And we're not able to have that.
I get it. Kathryn, I'm sorry we're out of time, but I get it. WholeWashington.org. Hang on.
This is the Thom Hartmann Program.
Kathryn Lewandowsky. Kathryn, thanks so much for dropping by. It's great talking with you.
You're welcome. Thank you. Have a great day.